Hello everyone. This time I would like to discuss about a patient. She came to me with some breathing difficulty. On fast walking, she is feeling panting and breathing difficulty. She is an asthmatic patient actually, using inhaler. But this time she is not getting relief in spite of using inhaler. So when I examined, I found that she is very pale. Eyes are very pale, her tongue is very pale, even skin is very pale. Pale means her hemoglobin must be lower. So this is called anemia. So I checked the hemoglobin and found that it's only 6. Normally it should be 12 gram per deciliter. So this shows that she has developed severe anemia. So when there is low hemoglobin, which is called anemia, this can happen. So the patient is asthmatic already. Along with that, she has developed severe anemia also. That's why she is developing this breathing difficulty while walking. And that's why she is not getting relief even after using the inhaler for the asthma. So reason for her anemia was different. She had very heavy periods, menstruation, and she is losing lot of blood from the body, which has resulted in low hemoglobin. And reason for her heavy periods, on doing ultrasound scan, she is having what is called fibroids in the uterus. So fibroids in the uterus is the reason for heavy bleeding, which produced severe anemia, which produced this kind of breathing difficulty on exertion on a patient who is already asthmatic. So what I am coming to say is this breathing difficulty on exertion can be due to many diseases. One important cause is anemia, and another one is asthma itself. If the asthma is not controlled, if someone walks fast, they can develop breathing difficulty, which is called exercise-induced asthma. Apart from this, there are so many other very important causes. It can be a symptom of cardiac problem, heart disease also. If the patient is having problem related to pumping of the heart, which is called cardiac failure, this kind of breathing difficulty on exertion can happen. So that is a very important cause for exertional breathing difficulty, cardiac failure. The patient is having very high blood pressure. That also sometimes produces this kind of breathing difficulties. Sometimes it can happen if there is fluid in the lungs, which is called pulmonary edema, which can be due to many reasons. It can be due to cardiac failure. It can be due to kidney problems. Sometimes this breathing difficulty on exertion can happen if there is fluid inside the coverings of the lung, called pleural effusion. Sometimes it can be due to some lung disease like collapse or fibrosis or interstitial lung disease. These are all some diseases of lungs which reduces the oxygen transfer in the body, resulting in low oxygenation, and patient feels breathless on walking fast. So if anyone feels like this, always consult the physician, undergo thorough examination and tests if needed. Okay? So take care of yourself. Bye.